Alright, so we're about to look at some other types of drugs and how these drugs can be able to help us to increasing urethral tone. You understand? So the whole thing here is you trying to increase the strength of the urethra, including of course possibly the sphincter, so that urine is being held back and urine is not leaking, or somebody is not passing urine when they don't want to. So another type of drugs which you could actually employ for this role is the adrenoreceptor agonist. Adrenoreceptor agonist type of drugs. So now we're now looking at what are the examples, and their mechanism of action. So alpha adrenoreceptor agonists, they can increase urethral tone by stimulating the smooth muscle contraction in the internal urethral sphincter. So now they'll now help you to keep urine back better, and avoid putting out urine when you don't want to. So their adrenoreceptor receptors, they are located in the smooth muscle of the bladder, neck, and proximal urethra. So when they are activated, it leads to contraction of the internal urethral sphincter. Do you understand? So this will now lead to increased resistance to urine want to go out, but your body is resisting it more. So drugs mimic the action of norepinephrine, enhancing urethral closure pressure, particularly useful in cases of intrinsic sphincter deficiency. So examples of these drugs, we have drugs like the Midodrine, we have the pseudoephedrine, then we have the Phenylpropanolamine. So Midodrine is often preferred because it is selective, and there's no much effect on the central nervous system. Then pseudoephedrine may be used, so you should use it carefully because it has some one or two effects on the heart. So for these classes of drugs, this is how they actually help us in treating these issues of stress urinary incontinence.